Welcome back. It may be 5 years since the start of the COVID-19 pandemic, but for some, the debilitating effects of long COVID remain. New research shedding light on the increased risks women face of developing the condition. Here to discuss this and other big health headlines, public health specialist and primary care physician, Dr. Saju Mathew. Doc, welcome back.
Good morning, Hena.
Good
nice
morning.
To be back.
Let's start with what I just mentioned. What factors put women specifically at a higher risk of developing long COVID?
You know, it's interesting. Women actually have a much better immune response when they initially get the virus. So they actually can ward off the virus quicker than men. Men may actually have more symptoms of a COVID infection. However, by revving up that immune system, the virus tends to be in the body longer, and it can actually cause an autoimmune-like condition. And that's pretty much what long COVID is. It's really unfortunate, Hena, because you're taking a healthy person, and now these patients are seeing a team of doctors like cardiologists and pulmonologists. Another reason could be hormonal imbalances like estrogen, whether it's premenopausal, postmenopausal. And also, women tend to see doctors more often than men, which is a good thing. It's also one of the reasons why women live longer. But as a result of that, the data tends to be more reported in women compared to men.
So if you are suffering with long COVID, what are steps you can take to alleviate some of the symptoms?
And the first thing is to really establish a good connection with your primary care physician. That's going to be, if you will, the headquarters of trying to deal with this. And then depending on your symptoms, we pull in other doctors, as I mentioned, like cardiologists and pulmonologists. But the most important thing is to listen to your body and to not be ashamed to tell a doctor that, listen, it's been 2 years since I had COVID and I have these symptoms that are still lingering.
And researchers found there's a link between blood pressure management and cognitive health, and that intensive blood pressure control lowered risks for cognitive decline. Why is that?
Yeah, you know, we talk about blood pressure in so many different ways.
Yeah.
We know how important it is, Hena, to every single organ in our body. People realize that it can increase your risk of heart attacks and strokes. But this study is specifically talking about brain health. You see, what happens is when you have persistent high blood pressures, it can affect the vessels in the brain. And by damaging those vessels, you're now at increased risk of vascular dementia and Alzheimer's disease. So that's why it is really important to make sure that your doctor is very aggressive about managing that blood pressure. And remember, blood pressure is not a number, it's a range.
Is there a way to monitor blood pressure at home, or do we have to wait till we see our doctor?
Yeah, I think I get this question maybe 7 times a day at the office. Remember, when you see the doctor, you're going to have a little bit of anxiety. You're not there to take your doctor out for coffee. You're there because you have anxiety, you have abdominal pain. So the most important thing is to monitor the blood pressure at home using a machine that checks your blood pressure here and not at your wrist. Obviously, healthy habits like reducing sodium, do not smoke, eating a healthy diet, but most importantly, taking that log in so your doctor can look at 14 to 20 readings at home, which is more accurate.
There's a different study I want to ask you about. Just this week found people with ADHD have a shorter life expectancy of between 5 and 11 years. What's going on here?
Right. Actually, you know, you're so right. In men, it's between, say, 4 to 6. In women, it might even be higher, 6 to 11. This is a 30,000 group of patients studied in the UK that showed a decrease in life expectancy. There are quite a few reasons for that. You know, the first reason is that when you have ADHD, you actually might have other conditions like anxiety, depression, difficulty to be able to kind of limit your executive functioning, maybe reckless behavior. So ADHD can shorten your life because of the other conditions. It's not necessarily directly because of ADHD, but because of reckless driving, increased risk of suicide, and mental health disorders.
And lastly, Doc, I'm running out of time, but so many in the newsroom are curious about this because of our bevy machine. There could be a connection between sparkling water and weight loss. What should people know?
Yeah, so hey, listen, at the end of the day, weight loss is all about diet and exercise and everything we talked about. But, you know, these studies are showing that carbonated beverages might actually help with increasing the metabolism by changing the pH of your blood. So the blood changes the pH and kind of absorbs excessive glucose, and that could be obviously contributing to more of a healthy condition. But also, if you have carbonated beverages, you might be less likely, Hena, to have sugary drinks. And also, it can make you feel full faster. So while this is not necessarily the most important thing, it's one of many ways of basically living a healthy lifestyle.
Well, especially with so many people going sober or not drinking, this is what's very popular right now. People love their caffeinated drinks. Dr. Saju Mathew, always a pleasure. Thank you, Doc.
Thank you, Hena.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.